the reason we're making these videos is to give you as much information as possible about what a knee or a hip replacement is like before you undergo the surgery. When I sit in clinic, I can give you lots and lots of information about the surgical technique, about the implants, etc. But actually, quite a lot of the time, the questions you have are best addressed by people who've had the operations done. A couple of years ago, I was very lucky to be able to do Dame Judy Dench's knee replacement for her. And she's kindly offered to give us some information today with me asking some questions about exactly what she went through and how she found having the knee replacement performed.
The thing about having a really dodgy knee is not only do you start to limp very badly, but also it's what I mentioned before, is that thing you hear bone on bone, and it's very, very disconcerting. And getting to sleep at night is hard because you can't get into a proper position. You know, it's hard to get into a position that's really going to afford you any kind of good night's sleep. But I mean, with me, it was lucky because I had to get better. I had to, you know. It's like my eyes. I can't see scripts and things, but I've had to find a way of learning and somebody teaching me. So you adapt, but it's difficult to do it with a knee because the more it hurts, the more you limp and the worse you feel. And the first thing that everybody says to you is, "Oh my goodness, how are you? You know, you don't look." So it's your pride really that should get you going. Okay. Oh, I think it woke me throughout the night, the pain. I had trouble with my left knee, and quite a long time ago, and I had an arthroscopy done because I was just feeling really uncomfortable. But actually, nothing like the right. Subsequently, which I remember being in Cornwall on holiday. I suppose it was about, how long ago was it? 5?
Yeah, 2-3 years ago probably.
Well, yes, yeah, three or 4 years. And I remember walking and being in pain before it, but then as I walked, I could hear something rubbing against something else as I walked, and that was unbelievable. I hadn't experienced that before.
This is a great question because everyone's different, everyone's x-rays look different, everyone's symptoms look different. And for some people, they can carry on with shocking looking x-rays, but are actually managing to function very nicely. Other people's x-rays don't look quite as bad, but actually the pain is very debilitating for them. And my opinion is to try and catch someone just before they get to the stage when they stop coping with the knee. Now, it's a fairly esoteric concept, but if someone is stopping doing what they would normally do, for instance, going for a long walk on a Sunday afternoon, because they're getting pain in the knee, that is going to stop the pain, but it's also going to mean that the muscular structures around the knee are going to be deconditioned. And so therefore the recovery from the knee is going to be that much more difficult. But it's a very difficult question. And as you'll see in the video that follows with Dame Judy Dench, that she gave a lot of thought to when was the best time to have it done.
Yeah, so did they change the script? Yeah. I don't know. How nice of them. Yeah. That was Stephen Frears, I expect, yes. Oh, no, she said, no, it was in the script.
Oh, was it? Right,
yes,
okay.
It was in the script, because she comes out with it straight away, doesn't it? The moment she meets somebody, she said, I have a hip repair. Titanium, she says, I think, she said. Yes. So it was rather convenient, you know. They say you should use everything you've got when you act. Well, there we are. How nice of it to oblige. And although it was summer, the sea was very cold, and I used to swim every morning. And that helped. That actually helped it by getting so cold. In actual fact, I couldn't feel anything, and that's when it was the most sore. I'm born optimist, so I thought I'll have this done, and then I'll give it. I don't know, 2 months perhaps, before I'll feel really kind of better. Okay. But of course, well, not surprisingly, but of course I felt a great deal better much sooner than that. I think it helps. I mean, I think swimming is, I've done that all my life and been very, very keen about it. And I think it kind of helps anything, really. Right. Help the arthritis, which I've got now, which my ma had. I think it helps that too enormously. And I know, although it was very sore doing it with my knee, of course the comparison to afterwards was nothing. It's glorious to be able to then swim, and not have that pain. I remember, the first thing I remember about the operation is having to walk up a flight of stairs the night I had it done. Have I exaggerated about that? No.
It was the second night. Actually.
Oh, it was the second night, was it? Oh, thanks, Jonathan. Yes, I do remember that. I remember, I think I had an epidural. Did I?
Yes, you did. Yeah.
I had an epidural, which I'd had when I had Finty, funnily enough.
Right. And sedation. You had a little
and
sedation, so you
I
didn't
did.
know what was going on.
And I remember having a nice chat.
Yes.
Then I actually don't remember anything else. It's so wonderful because usually people are chatting to you, and they say just do this. And I don't know with this because I've had all sorts of things, Achilles tendon snapped and everything like that. So I've done this quite a lot. But I remember them saying, we'll give you this injection so you don't feel anything. And then they say, now count to 20 or something. And you go, oh, well, this obviously hasn't worked. And you go, 1, 2, 3, 4, 5, 6, then you don't know anything. And you're crashed out.
Yeah.
And the next thing, somebody's giving you a good shake and saying, pull yourself together. It's over. Oh, I think it's essential. I mean, living in an old house, it was an essential thing because, I don't have a straight flight of stairs, carpeted flight of stairs. I have a wound round wooden flight of stairs, which are very uneven. And so that's essential, absolutely essential, to just have somebody there, even if you never come, if you never come to or need them, yes. It's just comforting. Yeah. And that's, if you possibly can, that's very comforting and it's essential.
Your leg back and forth.
Yes, that's very good. That's very good. Because, as you say, you've got to get it back to a certain angle. Yeah. So that's something you just have to have in your mind. You have to do it. It's not hard. But it requires a bit of effort and it requires a bit of concentration. But it's worth doing. Yeah. Really worth doing. I tell you, a very good place to do that is on the loo. Very, very good indeed. Just swing, could sit there with a book and swing your leg and get it back to a proper angle. No, I think that's the best kind of challenge because you think I'm going to do this and by this date or this time I'm going to be, as Jonathan says, I had to go to a premiere and I'm not walking up a red carpet at a premiere with a stick and a limp. I'm going to, even if when I get in I fall over. But so it gives you an incentive, a wonderful incentive. Just give yourself a goal and think by that time I'm going to walk this distance and I'm going to walk this distance without a limp. And that to a certain extent still happens a bit. But with both my knees, I mean, if I go anywhere, if I have to drive up to London and I'm with David, who has a dodgy knee and 2 dodgy hips, actually. They're both a bit better. We do rather a cunning thing, and that is we stop the car, or we get the car to stop about 5 minutes away, and then we get out. 2 very old people of 104 get out of the car. Then we swing around a bit and walk up and down. We get in, and then we spring out like gazelles when we get there, round the corner.
Well, of course, the difference between I get out of the car and no one's taking photos of me, but I guess for you to get out like a gazelle,
you can be very putting off. You don't want them to catch you doing that, but it doesn't often happen. And of course, the longer you don't go up and down the stairs, I mean, if if I'm down here all day and have no cause to go upstairs to my bedroom, then it's not difficult, and it only takes kind of 2 steps to get myself going. But then you're fine. It is a matter of mind over matter, actually. And if you're determined to get it right and to walk on it, and you've told your mind that you have a brand new knee, there's no reason why I can't, go up and down the stairs. Yeah. No, there's nothing. I was well prepared for it. And there's nothing that I would probably have done it sooner had I had the time. Right. I mean, I don't think there's any point in thinking this is going to get better, because it's not going to get better. It's probably going to get worse. So the sooner you can have it done, I think the better it is. And also the more able you are to do your physio afterwards, because that's essential. Absolutely essential to do it. I don't think there was a moment when I thought that. I thought, I'm so pleased I've had that done. And now I think you mustn't, the mistake is, I think, you mustn't think that it's going to be absolutely pain-free and wonderful straight away. It's what I can't reiterate enough about the physio. Because the more you do of that, and the more you can keep yourself, and just do a regime of, of just swinging your leg or whatever, the easier it's going to be for you. So it's what you require for yourself, really. And I had the thing at the back of my mind that I had to work very soon, and I had to dance, and I had to show that I didn't have a limp. So that was very, very good for me. It is, the shock of being taken up a flight of stairs the day after you've had this done it's very painful. And it is quite shocking. You think, I'll never be able to do this. But you can overcome that. And the more you do it, the easier it becomes. You have to exercise. You have to do it. You have to do the physio. And they come wonderfully at Runnymede. They came in every day and worked with me and gave me all sorts of exercises to do. And the more you do it, when I say you have to do it, it's up to you, really. If you want to get it working again, then you must teach it how to. And that's what the physio is about. So if you want to go on with a limp all your life, but maybe not so much pain, then you don't do the physio. But if you want to actually get back to what you were beforehand, almost, if you can, then do the physio.
The luxury of operating on Judy Dench is that she was very driven in terms of the time commitments, and there was only a very short window during which we could do the actual operation. Now, she'll allude to this in the actual the video itself, because she essentially only had 6 weeks in which she could get over the operation. And so, again, I think one of the things that's so important is to have a series of times that you have an idea of where you're going to be and when as you go through the process. Again, this is a great question, because we know, because I do hips and knees, I know that people get over hip replacements quicker than they get over knee replacements. And so if you think about it, there's a whole load of people who've had a knee replacement that are having pain and stiffness and difficulties for slightly longer than they would do if they were having a hip. And so I think the misconception is that knees are worse than hips. And I don't think they are. I just think it takes longer to get over them. And so therefore, in any given time frame, there's a bigger bunch of people who are getting over the knee than they will be getting over the hip. I think it's fair to say that it's very rare for any knee replacement surgeon to do a revision before 1 year. I think most knee surgeons would acknowledge that knees continue to get better for up to a year after the operation. Now, that's not a one-size-fits-all, and if someone is obviously struggling, then we may have to do something slightly sooner than that. But in general, I think the recovery can get better and better for up to the year period. As you'll hear with Judy Dench, the problem she had was going up and down the stairs, and that actually took her about 6 months to get over. But slowly but surely, as she did so, the stairs got better, and then by the 6 months, she was functioning very well. I think there is an increasing body of evidence that shows that if you can have physiotherapy before the operation, then you will do better. But of course, the physiotherapy quite often is walking. And if the patient is therefore walking a lot before the operation, then they're going to do better than someone who is tending not to do very much because they didn't want to have the operation but also weren't really in the mood for it. Every knee surgeon will tell you that when you have the patient asleep on the operating table, you test the knee from full extension, which is where it's absolutely straight, as flexed up as you can get it. And generally speaking, you don't let the patient off the table until they can put their heel on their thigh. So the range of movement you get during the operation is as close to full as possible. There is quite a lot of data, though, that shows that if your range of bend, your flexion, before the operation was restricted, you will have a restricted range afterwards, i.e. what you get afterwards is dependent on what you've got before. And this plays back to what I was saying a minute ago about trying to get on and do the knees before they start getting a very restricted range of movement. One of the most important things as a knee surgeon is to make sure that all of the non-operative courses have been exhausted. And the irony, of course, is as a knee replacement surgeon, I spend a lot of my time trying to persuade people not to have knee replacements done. And so the natural way of treating that would be to work your way up the analgesic ladder, starting with stronger and stronger painkillers, physiotherapy, steroid injections, and then if operative interventions are planned, to consider half a knee replacement or a high tibial osteotomy, and only then, once all of these considerations have been made, to go on and do the total knee replacement.